the president comes out and says there's a drug called hydroxychloroquine, which has been on the market for God knows 50, 60, 70 years, and another drug, Zithromax, which has been, it's a macrolide that's been around for at least, that class of drugs has been around for at least 70, 80 years. Maybe Zithromax, maybe Zithromax has been around for, I don't know, 20 years, whatever the case is. These are established drugs. They're safe drugs. Using them in combination, there are doctors that have shown at least 99% efficacy. They've shown hundreds and hundreds of patients they've treated. Nobody's died. Symptoms resolve within an hour, hour and a half to a day and a half, 2 days. Okay, so you've got this class. The president brings it out. And Fauci says, get this, Fauci says, unless there's some studies to show that, it should not be used. Yet he's promoting a vaccine that we have no idea what the hell that's going to do. And he's saying that's okay to use? I mean, if that does not show a conflict of interest, I don't know what does. People need to wake up and realize there is a massive criminal component to this. I know how to deal with the human body. We have had numerous people from all sorts of walks of life, from all sorts of different parts of the world, come to us with serious disease. And I can tell you that if we can take care of that, this COVID-19 is not an issue. And it's not an issue for many doctors. There are hundreds, if not thousands of doctors that feel the exact same way I do. You can do ozone autohumor therapy. You can do vitamin C. Already in China, they were using that. You can just freaking take selenium. There's misinformation being propagated by mainstream media right now about selenium. Selenium is a birth control pill for any enveloped virus. If you're really concerned about it, up your selenium dose for the next 10 days. It's so simple. You can get it from any health food store, but yet they're pushing this agenda for a vaccine. Well, bottom line is this, Gary. When you have an acute care situation and you have a respiratory condition, the first thing that you want to remember is to maintain the airway. So in trauma medicine and emergency medicine, we have what we call the ABCs of medicine. A is airway, B is breathing, C is circulation. So if the airway has a potential of being compromised, you want to stabilize that airway. So how do you make sure that a person is able to maintain that airway? We start off easily with 2 liters of oxygen per nasal cannula. You can increase it to 5, 10, whatever. At that point, then you can go to assisted breathing. You can go to CPAP, which is continuous positive airway pressure. Then you can go to BiPAP, which is bi-level positive airway pressure. And there's studies that show that actually CPAP or BiPAP is more effective than intubation. But as soon as you start intubating a person, now you've got many other things that happen. Okay, you've got the trauma, the barotrauma from the mechanical ventilation. That's an issue. You've got aspiration pneumonia as an issue. You've got the actual intubation process that can cause more inflammatory cascade and trauma to the airway. There's all sorts of different things. Once you start going into the intratracheal intubation part, there's all sorts of things that happen, potential problems. Now, what they've done is they have bypassed CPAP and BiPAP. They've completely bypassed it. They've taken people with respiratory conditions or respiratory stress and they've put them right into the intubation aspect. And the doctors that I'm getting feedback from are saying, yes, there is an increase in respiratory conditions of people having that in New York, but it's not viral. It doesn't seem to make sense. It's as a hypoxic injury. It seems to be where the hemoglobin is disassociating. There's some kind of a disruption. And there is an explanation for all of that, but it's being completely ignored. The videos that were censored, there was a letter and a number that was the keywords that made those things get censored, and that was Now, I don't know whether you want to talk about that. Nobody said caused COVID-19. That's what mainstream media is saying, that there's a conspiracy theory that caused COVID-19. Not even an idiot would say that, okay? Not even an idiot would say that. What we're saying is that it's changing the cellular matrix. It's changing the morphological structure of the cell membrane, and basically the specific thing is changing is the voltage-gated calcium channels that allow efflux of calcium into the cell, and efflux of calcium into the cell is pathognomonic for cancer. It causes a suppression of apoptosis and uncontrolled cellular proliferation.